All right, everybody, just doing chapter 23 as promised. Make sure if you have any questions, you let me know. Otherwise, we'll get started with lecture. I am lecturing to a empty room right now, which is kind of odd for me. Either way, let's get busy so you guys can get some lecture material. You are responsible to know what's on this lecture material. I will not be covering this in class. This is the actual in-class portion. So just remember that. Make sure you review this. That does not mean if you have questions you can't ask them. Just make sure you watch this. This is the lecture for chapter 23. I won't be teaching it in class. This is class. Nothing really new in this chapter that we haven't kind of seen already. There's a little bit of complicated math when it comes to rates going from a heparin rate to a mLs per hour, or something that the pump recognizes. But other than that, there's really not a big change for this chapter on math. And as always, this is an unedited lecture, so I'm not going to go back and try to edit it and make it pretty. It is what it is. So make sure if you have any questions, you email me and let me know. But let's get busy. So, point of us talking about heparin is, if used incorrectly, is a very dangerous drug. There's been recent heparin deaths. This book, or actually PowerPoint, is from the older version of the book. The content is still the same, but when it says recent heparin deaths, that is in reference to some horrible heparin deaths that happened 2007 and 2008. 2007, famous actor Dennis Quaid had twin babies, and guess what? Twin babies usually most of the time will spend a couple days in a NICU just to be monitored because of all the complications that can come along with twins. And so they will usually receive heparin because pediatric population, when it comes to IV catheters, when we put an IV in a patient, the pediatric population tends to have a higher clotting incidence when it comes to the IV catheter. So these IV catheters don't last very long because they get occluded with the clot. So with babies, what we use is a little tiny 10 unit per ml solution that we can flush the catheter with. It leaves a little heparin on the tip so it doesn't form a clot as fast, because heparin is an anticoagulant. And so, of course, most babies don't get IVs, but all the cases that I'm about to talk about all are twins. So these twins, spending their time in the NICU setting, having IV catheters, were receiving heparin flushes. That's what we call it, hep locking a patient. When we remove the IV catheter, we remove the IV from continuous IV fluids, we did a little lock on it. Saline lock is what we call it now. But back in the day when I first started, we used to flush hep locks, or the saline locks, with heparin every time we flushed the patient. Anyways, so the pediatric used 10 units per ml. At the time, and I even remember this being a nurse back in the day, at the time, the pediatric 10 units per ml looked very similar to the 100 units per ml and the 5,000 units per ml. Very similar packaging. So some hospitals, especially county hospitals, like when I did a lot of rotations at Maricopa County Hospital, you don't have the fancy pre-made flushes where it had heparin in it. You actually had to make your own flushes using a saline flush and a heparin solution. So Cedars-Sinai Hospital, Dennis Quaid's little babies are in there, and she was mixing her own heparin flushes for the shift so she could flush those little IVs on those cute little babies. And she grabbed the wrong type of heparin, and she gave huge doses of heparin to these pediatric patients. So thank goodness for the babies. My understanding is they made it through, but they made it through with some complications. Heparin in high doses can cause a lot of complications because you don't have any coagulating capabilities, so you can't blow clots. So what will happen is, let's say I have a bump or bruise, that could turn into a huge hematoma because I don't have anything to stop the bleeding. So with pediatric populations, it can cause intracerebral bleeds, anything a little bump of the head, a little bump of the arm. We can have hematoma or intracerebral wise, or we can have, you know, bad bruises on the baby's body. Anyways, there is an antidote for heparin, protamine sulfate, but you have to know that there was an overdose that occurred first. And so a lot of times babies with their small volume can bleed out prior to you figuring it out. 2008, there was 2 twins that were actually killed. There's 2 sets of twins in 2008 that were killed by heparin overdoses. And I remember this actually being in the field going, oh my gosh, and it was on the news, national news. So then they made, it took about till 2010, but they made completely different packaging for each different unit. We actually stopped using heparin for flushes. Because of the complication of HIT, which is heparin-induced thrombocytopenia. So, but heparin is a good drug though at the same time, but it is a high alert drug. It's one of the top 10 drugs that we actually have errors with, according to the Pharmacopoeia, U.S. Pharmacopoeia. So very, very careful. Most healthcare settings is used for cardiac patients, but it's a potent anticoagulant, prevents clotting, okay? Another thing is that it's not in milligrams or anything like that, it's actual in units, so it's heparin units, okay? It's a drug medication that when we're giving it to a patient on a continuous infusion, we will give it to them continuous infusion and monitor a lab called an APTT, or partial thromboplastin time. And we'll titrate our heparin based off of that, and that's just one of our tests for coagulation. There's multiple tests that we draw, and there's multiple parts of the clotting cascade that we can affect with different drugs. And so the one that's affected by heparin specifically is activated partial thromboplastin time. We do the dose by weight. It's given as IV units per hour, but we can give it sub-Q, but never IM. And we never give it IM because guess what? We're puncturing the muscle. There's going to be some bruising most of the time, and if I have an anticoagulant sitting right there where I punctured, I can cause nice big hematomas. There's not as much circulation in the sub-Q tissue of the fat, so that's why we can give it there safely, and we actually have a better consistent absorption when we give it in a good chunk of fat. We give it sub-Q primarily single dose or multi-dose because of we're doing sub-Q wise for prevention of DVTs or deep vein thrombosis. And the vials come in different concentrations. Most of the time in the hospital setting, after all these big cases that went through with heparin, most places, when it comes to availability to nurses, and they're using it from the Pyxis system, getting it from that secure system that we have all our meds in, it's only available to us in a 5,000 per 1 ml solution. We talked about this a little bit. Heparin and sodium for injection and heparin lock solution can never be used interchangeably. Heparin sodium for injection is the IV heparin. That's the one that we hang in the IV bags. Or we can give it sub-Q. Either way, it's a high concentration. So big dose, small volume. Heparin lock can never be used interchangeably. Heparin lock is that smaller volume, a smaller dose with a larger volume or more dilute for cleaning out heplocks, okay? But some facilities, now it's all facilities. If you're going to be giving heparin, it's all facilities, especially in IV heparin, all facilities require 2 nurses to check off the dose, okay? So you do the math, and we have a worksheet that you can fill out, and then you hand it to another nurse and you tell her the weight, and she does the math, and you make sure that all your numbers coincide. Now, we use, like I mentioned, heparin occasionally for the sub-Q patient that needs DVT prophylaxis. But there's actually better medications now, Lovenox and Fragmin, primarily Lovenox or enoxaparin, that's used for that reason, DVT prophylaxis. Problem with Lovenox is it's hard on the kidneys, and it's primarily excreted by the kidneys. So if a patient has a decreased GFR, glomerular filtration rate, or a high BUN creatinine, something telling us that the kidneys aren't working that good, they'll change the dose of Lovenox or switch them to heparin sub-Q. And that's primarily, when I first started nursing, we almost gave everybody heparin sub-Q, Q8 hours. Now it's pretty much switched to Lovenox, Q12 hours or Q24, unless they have kidney problems and they're on heparin. Here's some ideas of what the labels look like. I mean, you can see 10 units per ml, that's the normal flush. 100 units per ml, normal flush. If you look, hep flush, heparin flush. Those are both things that are trying to help us not make an error. But if you look over here, heparin sodium for injection, 5,000 units per ml, 10,000 units per ml. And I'll tell you what, they all come in pretty close to the same vial size. So that's scary. You know, you can cause an error pretty quick and not even realize it. So, some things, we talked about a little bit about this with insulin, and some people got some points off on the homework for it. But we, just like insulin, when you're calculating sub-Q doses or any dose for heparin in that matter, there is no rounding. Okay? Use a TB syringe. Most of the time the volume will be under 1 ml, and that is TB syringes can go down to the 100th of an ml, right? So we can be pretty accurate in our calculations and get this almost exact dose if we use a tuberculin syringe. Sometimes they may be prepackaged. Heparin is usually not prepackaged. We have to do that ourselves, but the Lovenox and Fragment come in prepackaged syringes that have the exact dose in them only, and all you have to do is pull it out of the package and inject it in the patient. But just remember, never round doses. So let's talk about this. Heparin, order 7,500 units sub-Q now. Heparin's labeled 10 units per ml. You can use the formula method. Like I say, there's more than one way to do things, and whatever makes sense to you, you can look in the book, you can see what works for you. Whatever makes you get it right the same every time, that's fine. I don't care. I would prefer dimensional analysis, and that's what I'll show you here. So if I was going to do this, I have my order of 7,500 units, and once I've done writing this down, I'll switch it. Available 10,000 units per ml. All right, so order 7,500 units of heparin, available 10,000 units per ml. Okay, so order first 7,500 units times. What's our conversion factor for this dimensional analysis? Obviously our variability. That was supposed to be an underline, sorry. So 10,000 units for 1 ml. So I cross out units. Guess what? I know I have the right stuff because I have mLs left. 7,500 times 1 equals divided by 10,000 equals 0.75 mLs. Okay. Easy peasy. But that's the formula method if that's how you want to do it. And I might have you mark on there if you want. There's some, I think, some questions that will have you identify that, but I'm having a hard time remembering from last semester. So, this is the more complicated math, calculations of IV heparin solutions. Yeah, sub-Q stuff is easy because all you're dealing with is a single dose and a single concentration. There's no rate factor to it. So this is a little more in depth. So we'll have an order like this: infuse solution of D5W with 20,000 units of heparin at 30 mLs per hour. Calculate the dosage of heparin the client receives per hour. Okay. There is a missing component here. There is no volume on that 20,000. So don't want to assume until we realize there that it gives us 20,000 units per 1,000 mLs or 1 liter. So we can use the ratio proportion method if you want. 20,000 units over 1,000 mLs. We know that's our known. Our unknown is how many units per 30 mLs that they're getting, right? You have to understand though that you have to add that per hour on it. So the only reason that 30 mLs is there is because we know that they're getting 30 mLs per hour. Okay? So don't forget that if you're going to use the ratio and proportion, because if you just put 600 units and you don't have the per hour because you forgot to add it because you use ratio and proportion, you're going to get it wrong. You have to have the hours on there because that's an important component. There's a time component. So let's do this in dimensional analysis. I have order of 30 mLs per hour available 20,000 units per 1 liter per 1,000 mLs. Okay, here we go. So with dimension analysis, we start with our order, right? 30 mLs per 1 hour. We just want to know the dose, how much units are getting per hour, right? What's our units per hour? So what can we do? We already have hours on the bottom, so we know that we've got that portion, right? We don't need to do any messing with hours on the bottom. So we do have mLs that we need to convert to units. So it's my conversion vector. That's my available with the units right there. So I'm going to put 1,000 mLs on the bottom. That way these cancel out, leaving me with 20,000 units on top. My leftover units are now units per hour. Units being on top, hour being on bottom, making it per hour. So 30 times 20,000 equals, divided by 1,000 equals 600 units per hour. Okay? So now that's how you would do it in dimensional analysis, which is what I prefer, because it works for everything, primarily everything. Okay, and that's them showing dimensional analysis. They do a little bit backwards compared to what I do or what those videos I have put on there show you. Okay, so just remember that we don't just eyeball heparin when we're infusing it, you know, with the roller clamp, and we don't usually do drops per minute when it comes to heparin. We usually use electronic pumps, and it's going to be always in mLs per hour. So here's our order. Infuse 850 units per hour from a solution containing D5W 500 mLs with a heparin of 25,000 units IV. This is pretty close to what we use in the hospital. What we use in the hospital setting actually is 25,000 units per 250 mLs. It makes the math a lot easier because that makes it a, was it a 100 to 1 or 1,000 to 1? I have to do the math, but it's an easier one to figure out. So 150 units per hour from a solution containing D5W 500 mLs with heparin of 25,000 units. So let's do that. I'm going to write it down on my piece of paper. Order 850 units per hour. Available is 25,000 units per 500 mLs. All right. Let's look at this. order 850 units per hour. What we have available, 25,000 units for 500 mLs. So order first, 850 units per hour. I need to move this dog cam, it's killing me. There we go. Per hour. Okay. 1 hour. My available is, I need to find out how many mLs per hour I'm going to run it because I'm going to put it in the pump. So I know I have units right now per hour, so my time component needs to be in hours. So this can stay. No need to do any conversions for that. So 850 units per hour, and I need mLs per hour, so I need to cancel out my units. So my conversion factor right here, 25,000 units per 500 mLs. With my units on the bottom, remember dimensional analysis, that's interchangeable. You can flip it either or to cancel out which units you need. So 500 mLs. Units cancel out, leaving mLs on top, hours on bottom, making it mLs per hour. So, calculator there. 850 times 500 equals, divided by 25,000 equals, I'll be infusing at 17 mLs per hour. mLs per hour. Okay? So, ratio proportion, you can set it like that if you'd like. Either way, we come to the same end result, 17 mLs an hour. Dimensional analysis. You can cross out those zeros if you want. At the very beginning, 25,000 units per 500 mLs is the same as 250 units per 5. Whatever makes it easier for you. I usually tend to, so I don't mess things up, I just do it as it is and plug it in the calculator because that's what they make calculators for. If I was doing this by head and like just really quick on a piece of paper using my head because I don't have a calculator readily available to me, I would definitely cancel out those zeros. But it's not detrimental to the math unless you're trying to do it in your head. Some ideas about heparin. There's protocols. We don't just do things willy-nilly with heparin because of its potency and what it can cause when it comes to side effects and adverse reactions. So we'll have a protocol that we plug in the patient weight to, and it automatically tells us based on this PTT, this is what you should be infusing at. And if it's your PTT's this, then you need to increase it this amount. If your PTT's this, then you need to decrease it this amount. Or if your PTT's super high, you turn it off for an hour and then start it at this new rate. Because of the half-life of heparin, you can pause it for a short time and it will die off slowly and be metabolized in the body. So, but just remember, we got to get a heparin level right away to we usually do it for an urgent situation. So we don't want to wait for the heparin to kind of slowly come into play. We give them a bolus dose right off the bat. So we give a bolus or loading dose, and then we'll start that infusion. But reason that's all caps, accuracy is vital, okay? Too large of a dose can cause a hemorrhage, whether it be in the brain or if they have had recent surgeries or anything like that. And too low a dose would cause thrombus or emboli. And for the patient that has a possible cerebral event or some sort of stroke, that's bad. For somebody that has some sort of occluded artery in their heart, that's bad. So we want to make sure that we try to keep them within the normal range when we have them on a heparin drip. So, client weighs 160 pounds, administer heparin sodium IV, protocols for 80 units per kilogram. How much will the nurse administer? So, let me write this down. We can look at it right here. We just can calculate the weight. We can use dimensional analysis. But we should know by now that 160 pounds divided by 2.2 is going to give us kilograms. Okay? And then we just take that kilograms that we've calculated, 72.72 or 72.7. We can round it to the tens. 80 times 72.7 is going to come up with 5,816 units. Okay? And we can use a tuberculin syringe to measure that out and be pretty dang accurate. So, what if the patient weighs 165? Guess what? Same thing. 165 divided by 2.2 gets us kilograms. So we can take that 80 units per kilogram and multiply it by the kilograms that we figured out. Something though additional here is, look at this. It says then initiate a drip at 18 units per kilogram per hour. So that's the extra math that we need to figure out. So it would be 18 multiplied by the patient weight in kilograms, and that will give us our dose of units per hour. Okay, so let's do that math. We know we have a 165 pound patient. Order for 80 unit per kilogram load. And this is not uncommon. This is an actual dose. I've done this exact math prior for a patient almost weigh the same. And then infuse at 18 units per kilogram per hour. Okay, so let's do this. So my patient's 165 pounds. So 165 divided by 2.2. Exactly, 75 kilograms. Okay, so now we know what we need to plug in. So for the bolus dose, 80 units per kilo is the same as saying 80 units times kilograms. 80 times 75 equals 6,000. 6,000 units. This is my bolus dose. And then, we need to know how much bolus dose we need to give them. So now we have our order. 6,000 units times, remember we had, I forgot to write this down, available 25,000 units per 1,000 mils. Okay, so 6,000 units, we need to find out how many mLs bolus is going to be. So 6,000 units, we need to cancel out units, so we're going to put our units on the bottom for 1,000 mLs. Cancel, so now we know mLs. 6,000 times 1,000 equals, divided by 25,000 equals 240 mLs for the bolus. Okay, 18 units per kilo per hour. Let's figure out the drip now. 18 times 75, because that's our, we're going to try to figure out our dose, times 75 equals 1350 units per hour. See that? 18 units per kilogram per hour, 18 times 75, and we didn't do anything but add the hour there. So 1350 units per hour, and I need to know mLs per hour because that's what I need to put in my pump. Time to do some dimensional analysis. 1350 units, that's my dose, per hour. Do I need to do anything with hours? No, I don't, because what's my pump running? mLs per hour. So since I'm running in mLs per hour, I don't need, the time component doesn't change. So hours it is. I don't need to do any conversions for that. Okay, so I need to know mLs per hour. Hours on the bottom there. I need to have, use my conversion factor. Right there it is, my available. But I need to cancel out units and have mLs left, so I have 25,000 units on the bottom with 1,000 mLs on top. Units cancel. What is left? mLs on top, hours on bottom, meaning mLs per hour. 1350 times 1,000 equals, divided by 25,000 equals 54 mLs per hour. Okay? That is what I would program in my pump. Okay, so here's some step-by-step. Calculate the weight. Calculate that heparin bolus dosage by, this has got the wrong weight on there for the calculate the heparin bolus. but the math is still the same. It would be 80 units times 75, which we did that for, and it turned out to be 6,000 units instead of 5816. Either way, number 3, calculate the infusion rate for the IV doses. We got that figured out, 1350 for the units per hour, and then we could do dimensional analysis to figure out that we had 54 mLs per hour. So it didn't have you calculate the volume for that, but some questions might, and in real life, when we do it, we actually calculate that bolus volume also. Hopefully that answers your questions. I'm going to pull up a couple questions from the book really quick. I have another class that I'm going to be lecturing for here shortly, so I'll do some more questions from the book though, just so you can have a little extra practice. Let's see. If you can tell though, this is really not too much different than what we've already been doing, okay? All right, page 602. Let's look at order. 50,000 units. Oh, let's switch it over to. 50,000 units and 500 mLs available. $10,000 units per ml. If you see one like this, what this means is I'm trying to figure out how much of this solution I need to add to this solution. Okay, I'm going to have a 500 ml bag, so I need to know how many mLs from this solution I need to put in that 500 ml bag to get my 50,000 units. So our order is 50,000. Do I need to do anything with that 500? No, because I'm just adding this amount to that, to the 500. So 50,000 units is my order, times my 10,000 units. This is using dimensional analysis, so all my units cancel out for 1 ml. Units cancel. I can do this really quick, cross these out, leaving just a 5 over 1, so 5 mLs is my answer for that. Let's do another one. Number 8 on 602, same page. Order. 15,000 units sub Q daily. Available 20,000 units per ml. So order first 15,000 units. Dimensional analysis. I want my units to cancel, so I put that on the bottom, 20,000 units per 1 ml. Units cancel, leaving just mLs. I know I have the right answer if I do the math. So 15,000 times 1 equals, divided by 20,000 equals 0.75 mLs. Okay. Those are pretty straightforward. Let's do some rate problems here. Page 603, number 13. Order. Heparin. By the way, this is the heparin chapter, so that's pretty much assumed. Heparin, 2,000 units per hour IV. Available. Heparin, 25,000 units. 1, 2, 3. Per 1,000. 1,000 mLs. Okay. So I need to figure out mLs per hour to put it in my pump, right? My order first, 2,000 units per 1 hour, okay? Times, I want units to cancel out. My time unit is already hours, so I don't need to do any conversion there. It's on the bottom, ready to be used for the answer, so I don't need to touch it. 2,000 units per hour, and I have 25,000 units with the units on the bottom to cancel out per 1,000 ml. So that leaves mLs on top, hours on bottom. I know I have the right answer, mLs per hour. 2,000 times 1,000 equals, divided by 25,000 equals, if I can push the right buttons, 2,000 times 1,000 divided by 25,000. There we go. 80 mLs per hour. Okay? Let's do another one. Heparin. Order. Heparin, 1,500 units per hour. Available, 25,000 units per 500 mLs. So what's my mLs per hour going to be? So my order first, 1,500 units per 1 hour. Okay, I have hours, my time unit already, I don't need to mess with it. So I don't need to do any conversion for that. Hours on the bottom where we want it. But I need mLs per hour, not units per hour, so I need to have my units on my conversion factor on the bottom here so that I can cancel it out and have mLs on top. Okay, units cancel out, leaving mLs per hour. I know I said it up right, so once I do the math, it's good. 1,500 times 500 equals, divided by 25, 3,000. 30 mLs per hour. Horrible handwriting, sorry. Okay. Here, I'm going to do a couple here that you might see. Okay. This is on number 34 on page 605. Order 20,000 units per 1,000 mLs. 1,000 mLs to infuse at 45 mLs per hour. What's my hourly dose of heparin? Okay, so let's figure that out. Hourly dose of heparin. So my original order is 45 mLs per hour, right? Don't get confused with this. This is just our concentration. This is the actual order. 45 mLs per 1 hour. Okay, I want to know a dose of units per hour. So I don't want to mess with hours because I already know that right there. Hours are on the bottom, it's ready to go. I want to cancel out my mLs to know that I have units per hour. So I'll put 1,000 mLs on the bottom with my 20,000 units on top. Canceling out the mLs, giving me units per hour. Now I'm ready to do my math because I have the right units. 45 times 20,000 equals, divided by 1,000 equals 900 units per hour. Okay. This is not focusing. Stare at that for a second, that chicken scratch. All right, I'm going to do one more of these, just to give you an idea what you might see. This is number 35. Order. Actually, I'm going to do another weight base. Let me see if I can find one. No, you guys can practice with that too. Number 47 on page 606. Client weighs 200 pounds. Actually, I'm going to jump to 48. I like that one better. That way we get all of it in one question. Client weight, 210 pounds, which is, let's do the math for that. 210 divided by 2.2 equals 95.45, so let's say 95.5 kilograms. Okay? Available is 25,000 units in 1,000 mLs. 25,000 units per 1,000 mLs. Okay. Order 80 units per kilogram. What was that here? 80 units per kilogram bolus. 14 units per kilogram per hour infusion. Okay. Client weight, 210 pounds. You've already converted that, divided by 2.2 to make it 95.5 kilograms, rounded. Available, 25,000 units in 1,000 mLs. Okay, in our order, first is 80 units per kilogram bolus, and then 14 units per kilogram per hour infusion. So let's do the bolus first. 80 units times 95.5 kilograms. So our bolus, times 80 equals 7,640 units. Okay, that's our bolus, units. Let's go ahead and figure out the mLs for that we would give IV bolus. 25,000 units per 1,000 mLs. 7,640 times 1,000 equals, divided by 25,000. So our initial bolus dose is 7,640 units, and that will be 305.6 mLs for the bolus, using this dimensional analysis, leaving mLs behind. Okay, so we know our 80 units times 95.5 gives us our bolus dose of 7,640 units. We need to figure out the mLs to put into our pump. So 25,000 units on the bottom, so units will cancel out, leaving mLs. So 305.6. Am I cutting it off? There it is. I apologize. 305.6. Okay, I'll let you look at that just a little bit longer. Now, let's do our infusion. Infusion's right here, 14 units per kilogram per hour. So I have my kilograms, so I know I'm going to take 14 times my kilograms. 14 times 95.5 equals 1337 units per hour, right? Because all I did was take this 14 times 95.5, I just plugged that right in there. 14 times 95.5 per hour, which is 1337 units per hour. Okay, that's our dose per hour. Now let's figure out our rate, which is mLs per hour, so we can put it in the pump. 13 37 units per 1 hour. Follow closely, I'm sorry, it's a little bit on the crowded side here. Ran out of paper. Okay. 1337 units per hour times, what's my concentration? It's my available over here, right? I've shaded. Available. Okay. So that's going to be, I want units to cancel out because I'm already in the time unit of hour, so I don't need to do any extra math there. So I have 25,000. No, that's 250. Minus that one. Got a little carry away with the zeros. 25,000 units with 1,000 mLs equals. Units cancel, leaving me in mLs per hour. So have I set it up right? Yes. 1337 times 1,000 equals, divided by the 25,000 units, tells me I have 53.48 mLs per hour. What does my pump read in though? It only reads in tenths. So this is one of the few times that you have to round, right? Because remember we said you don't round heparin dosages, but you can round the mLs per hour for the pump. Only to the tenth though. So 53.48 would round to what? 53.5 mLs per hour. Okay? So I'm going to make sure that that's nice in view. Okay. Take a good look at all that math. 53.5 mLs per hour is my 14 units per kilogram per hour based on the concentration and weight of the patient. Concentration, solution, and weight of the patient. My 80 units bolus per kilogram, so 80 times 95.5 kilograms, because that's my patient weight based off of the 210 pounds, equals 7,640 units. Okay, we need to know how much volume to put into the pump, so we got to figure out that in mLs. So using our concentration again from 25,000 units per 1,000 mLs, we get 305.6 mLs. And then just again, 14 times 95.5 for our kilograms per hour here, units per kilogram per hour, gives us 1337 units per hour, because the two of these combined. Then we use our dimensional analysis, 1337 units per hour, hour being on bottom, so we know right off the bat we don't have to do any time component for our dimensional analysis. We just have to make sure that we keep track of it being on the bottom. We want units to cancel out, so we put 25,000 units on the bottom with 1,000 mLs on top, leaving mLs per hour, just like we want. 53.48 after we do the math, with us rounding to the 10th because our IV pumps only run to the 10th. So 53.5 mLs per hour. Hopefully that makes sense to you guys. If you have any questions, make sure to give me a holler. Otherwise, that's it for chapter 23. And hopefully you guys watch this and have a good day.